Hello, everyone. Welcome to our webinar, our roundtable about using digital solutions to support COVID-19 rapid diagnostics, hosted by Digital Square. For those of you who don't know Digital Square, we connect health leaders with resources necessary for digital transformation. One of the ways we do that is by hosting roundtables and webinars like this to help our global goods community thrive. We are going to have a presentation by Abha Patil, who's going to walk us through the dSTARR project, give us a sense of the approach, the methods, and the findings. And then we'll have about 30 minutes to discuss the use cases that they've identified and think through what's feasible to implement, what types of tools already exist, and where solutions may or may not be appropriate for those use cases. And just a quick note, in case you've missed it, this webinar is being recorded, and as with all other Digital Square webinars, it will be posted on our wiki. We'll share the slides from this presentation as well. And then last but not least, I'll ask that everyone mute themselves during the presentation portion of this roundtable, and then we'll ask that you raise hands to ask a question. I will be calling on folks to make sure that we don't have too many folks talking over each other. All right. With that, I'm going to turn it over to Abha, who is a market access officer with Diagnostics Group at PATH. She holds an MPH in health systems and an MBA from Johns Hopkins University and is a BS in biomedical engineering. And she was one of the lead researchers for the dSTARR project. So I'm going to go ahead and turn it over to her.
Thank you so much, Brunda, and everyone for joining today. Let me just share my screen. All right, can everyone hear me okay? All right, we're gonna get started today. Then good day, everyone. Thank you so much for joining us in this roundtable discussion. My name is Abha Patil. I am a market access officer in the Diagnostics Group at PATH, and I am excited to present a stakeholder and market needs assessment to inform the development of digital solutions to support COVID-19 diagnostic testing under one of our projects called dSTARR and engage all of you in some meaningful discussion. First, I'll provide an overview and methodology of this assessment. PATH is working in conjunction with the ACT Accelerator, which is dedicated to improving access to COVID-19 tools, and our partner FIND. The goal of the dSTARR project is to improve data collection and mitigate current pain points associated with COVID-19 testing in low-middle income countries. Ultimately, we aim to develop standards and enhance interoperability of patient and diagnostic data collection platforms, ensuring that these solutions are sustainably incorporated in various settings. As a first step in this project, a global stakeholder and market needs assessment was completed to understand unmet needs and identify opportunities to leverage a digital solution for use with COVID-19 antigen rapid diagnostic testing. Our team will use the findings of this assessment and your feedback to align specifications, identify expanded use cases beyond data capture, and inform our human-centered design approach to solution development. Antigen rapid diagnostic tests, or antigen RDTs, are being rolled out at a much larger scale across the globe today, especially where resource and capital-intensive PCR or polymerase chain reaction testing may not be feasible. Antigen RDTs use a method of lateral flow assay, which can detect a viral protein called antigen of the COVID-19 virus in less than 30 minutes. This allows for the qualitative detection of COVID-19 virus through point-of-care testing, usually using a nasopharyngeal or other respiratory sample. Here are a couple examples of how these tests look. These are from the companies SD Biosensor and Abbott Diagnostics. We conducted interviews between May and August of 2021 with 24 stakeholders from 5 countries shown here: Brazil, Senegal, India, Vietnam, and Zambia. These countries were chosen in conjunction with our FIND partners to promote geographical diversity and taking into account other criteria such as operational presence and COVID-19 situation. Interviewees were purposefully selected based on role alignment with topics, and a qualitative interview guide was developed to be used across all countries. Interview questions related to the following themes were discussed: And in addition, interviewees were also asked about their understanding and experience with the country's digital health infrastructure and usage, which is reflected in our analysis of digital ecosystem later on. Ultimately, this assessment is to inform the development of expanded use cases beyond data capture forms, which are already in development. These expanded use cases may include referral support, patient management, overall clinical management, digital record keeping, reporting, and surveillance, capacity strengthening, and supply chain support. Later on in the roundtable, I will be asking any of you to provide feedback around the feasibility of any of these use cases. Finally, the stakeholders we interviewed were across various functions from policy or government to laboratory experts, and you can see all the organizations we interacted with and received feedback from on the right for a total of 24 stakeholders, pretty much evenly spread across the 5 geographies. Now I want to dive into some of our synthesis and key findings. So we created this heat map to show the qualitative success of the expanded use cases and interviewee determined definition of digital ecosystem based on the stakeholder interviews that we conducted in each of the countries, which are on the horizontal axis with use cases on the vertical axis. We're going to go into this a little bit deeper, so don't feel like you need to take it all in right now. So first, just to dive a little bit deeper, initially, we just wanted to show that the number of antigen RDTs approved for use in our various countries are widely variable, from 2 in Zambia all the way to 79 in Brazil. So that really changes how a digital solution could be utilized. In terms of referral support, we were seeing that across the board there are some variabilities in referral. Oftentimes there's disconnect between facilities, and there isn't really a connected way to provide referral support between patients and facilities. In terms of patient management, many countries have developed their own kind of centralized standards and provide results on various mobile platforms, often through WhatsApp or through a phone call, but they're generally lacking a centralized information system and centralized place to conduct contact tracing. In terms of overall clinical management, many countries have robust and expansive networks of care, but often there are differing data management systems across facilities, and that makes it difficult to really share patient information in the various settings. For digital record keeping, reporting, and surveillance, there is great variability. In Brazil, for example, they have robust data management systems, but really require duplicative entry and lots of parallel systems management, while in Vietnam, they have a more disjointed lab system and are really lacking consistent internet connectivity. In terms of capacity strengthening, we were finding that various countries may have centralized guidance, such as India, but it's often not reaching the healthcare workers in time, and they're working off of non-updated training and guidance. And there's lots of high turnover of staff and really difficulty in adhering to guidance because it's changing so often, especially in Zambia. In terms of supply chain support, there were a few countries that had more robust systems for procurement, but many of them were really lacking the kind of feedback loops to use demand forecasting and properly quantify the usage of supplies at the facility level. Finally, when we asked interviewees about their experience with digital health tools and the overarching digital ecosystem in their country, we had very wide responses from country to country. In Brazil, they have really strong usage of digital tools and information systems, but in Vietnam and Zambia, they're really lacking the infrastructure and strong network connectivity to often have these integrated systems. So this is really just an overview of kind of what's working and what's not in each country. I'm going to dive a little bit deeper into some key takeaways for each country next. So in Brazil, the current status of the COVID-19 diagnostic testing is that antigen RDTs have rapidly expanded the capacity to allow for improved results turnover and contact tracing. And though COVID-19 data reporting is mandated within a federal system, because of all of these parallel systems, one at the federal level, one at the municipal, and one at the primary healthcare workers are really overburdened and required to enter data multiple times. So a new digital tool should really consider the local specificities as opposed to national implementation, as these information systems across municipalities are not standardized, and there is kind of difficulty in integrating national tools. They certainly need to be interoperable with the many existing information and data management systems, and really allow for content change depending on the local context, because guidance and guidelines were variable at that local level. And digital tool developers should really consider the structure of the numerous existing data management and information management systems and focus on healthcare workers at the primary healthcare level. In India, the current status of antigen RDT testing has also expanded rapidly, especially during India's second wave of COVID-19. And India does have a centralized reporting database called ICMR, where all data is reported into, and there are portals for training and guidance available. But there are extremely lengthy data entry processes, and especially combined with the large volumes of people requiring testing at various facilities, this creates backups and incomplete data. So a new digital tool really needs to be adaptable to varying volume of testing at different facilities and interface with the existing centralized data reporting portal. And developers should really consider how to create a tool that can be flexible based on differing volumes, and how to leverage the already existing centralized reporting and guidance portals to get that information out to healthcare workers more expediently. In Senegal, interestingly, the current status is that Ministry of Health has strict guidelines on the use of antigen RDTs, and they can only be used in public facilities due to specified training and infrastructure requirements. So there is kind of this disconnect between public and private facilities. And data reporting and contact tracing are already being conducted through the DHIS2 centralized system. So a new digital tool should really provide a data link between antigen RDT test results and confirmatory PCR testing, which is being required in Senegal at this point because of kind of mistrust in antigen RDT quality. And a tool really needs to connect with DHIS2 and standardize the type of data collected and the reporting forms that healthcare workers are interacting with. So developers should consider how to connect data collection between the public and private facilities to make for a more efficient facility experience, and what kind of content would improve healthcare workers' confidence in the use of antigen RDTs. In Vietnam, antigen RDT capacity has expanded rapidly in response to major outbreaks across the country, especially in the last couple of months. Actually, a lot of the information that we had received from Vietnam earlier on in the months of March was quite different than when we had to re-interview some of our PATH staff in August to get the update. And there are really disjointed data management systems between the lab and healthcare facilities. So a new digital tool really needs to be amenable to fluctuations in testing volume and focus on outbreak management, as that is one of the key issues in Vietnam right now, and needs to be able to input data from various sources as some of those lab networks are disconnected, and really work in node to low network connectivity environments. So developers should consider potential areas for automation in data capture or any of the expanded use cases, especially for use in high volume testing areas, and how to take into account and develop for a lack of widespread digital infrastructure. Finally, in Zambia, antigen RDTs are available, but recently, due to fluctuating supply, guidance is changing, constantly changing for testing requirements. Zambia has an interesting hub and spoke model of data reporting through their labs to more centralized facilities. And this is called the DISA Lab and DISA Link system. So a new digital tool should really facilitate data completeness for the returning of test results to patients and reporting of results up to higher ups, and should interface with or build upon some of the existing digital data collection tools which are in use in Zambia for other health issues, and really create that data linkage between testing and patient information. So developers need to consider what types of mobile functionalities would be appropriate for use in both facility and community-based interactions, as healthcare workers are really in both settings, and methods to minimize transcription errors and decrease time to collect data. So next, we are going to get into a bit more of discussion. So I just wanted to lay out that the use cases that we'll be discussing are the 6 listed here that we have kind of talked through in various parts of this presentation. And the questions that I would really like to ask our audience today, and Vrinda, if you could also paste these into the chat, are what digital functionalities or opportunities would be most feasible to implement to support the near-term introduction and scale-up of antigen RDT uses under the following use cases? And we'll go kind of use case by use case. And for anyone with experience in the field out there or in antigen RDTs, really what existing digital solutions have been successfully incorporated into these use cases for tracking various diagnostics. Third, what are use cases, users, or parts of the workflow where a digital solution would not be appropriate? And if you can think of any potential unintended consequences of a digital solution. All right, so we'll get into a bit more of discussion. So the first use case is for referral support. So here we've just mapped out the use case and the 4 levels of use where it could potentially be implemented. First at the patient level, at the provider level, at the district level, or at the country level. And some opportunities that our team had identified were at the patient level, viewing referrals in centralized mobile platforms or receiving referral reminders. At the provider level, having a more comprehensive referral platform available, the ability to share patient information between facilities, and the ability to follow up on incomplete referrals. At the district level, potentially identifying and locating nearby health facilities. And at the country level, developing a health facility registry for referrals. And you'll just note in the corner there, we have a kind of in scope or out of scope for digital solution. And that was what our team had deemed in scope and out of scope. But I think that since this is kind of an open forum for feedback, we are certainly open to hearing if you have any differing opinions. So keeping those kinds of questions in mind that I had laid out, and I think Brenda has put in the chat, does anyone have thoughts on the potential of developing a digital solution for referral support within antigen RDT testing? And Brenda, I'll kind of hand it over to you if anyone wants to speak up. You're also more than welcome to put anything into the chat, but I think we'll give kind of 5 minutes for this discussion.
Encourage you all to raise your hands or throw in a question or a comment. We'd love to hear from you.
If anyone maybe has experience in using a digital tool for referral support or has seen referral support being used well for between antigen RDT testing and further clinical management, anything?
Hi.
Hi, Natalie. Go for
Hi,
it.
how's it? I'm not sure if my colleague is on, but I'm with Damagi and our new business unit, and we're currently kind of in beta testing stage of a product called Circle, which in essence is a platform for scheduling health appointments and coordination of health appointments. Yeah.
And I guess if I can probe a little bit further, what kind of need do you feel like that was born out of, and what are some kind of issues maybe that you're facing in developing a more comprehensive referral support system?
Sure. I mean, the reason I'm somewhat hesitant is I'm less involved than some of my colleagues, but I'm not sure if they're on the call. But basically, the idea around Circle came about around COVID vaccine delivery and around the challenges of how do we follow up between the two sets of vaccines. So if one vaccine was given to a patient, how do we ensure and follow up to ensure their second jab is given? So that was sort of the idea around the creation and building of Circle, which in essence is kind of a two-sided marketplace where you need the providers to actually put in and build out sort of their calendar. And so the idea, it's, if anyone's used Calendly, it's similar to that, but obviously used for, the idea is offline. It doesn't have to integrate with existing calendars nor email IDs. And, healthcare facilities can fill out sort of the appointments and the types of appointments and stuff that they have available in different areas, and have, all of their healthcare providers in different, if it's more than just COVID, if there's maternal health appointments and so forth, they can submit everything and put it into the back end, and then through kind of a chatbot methodology with WhatsApp and and ideally, we're not there yet, but SMS, patients will be able to kind of book appointments and be able to communicate with those health facilities.
That's great. Thank you so much for sharing.
Sure.
Curious, are there any other gaps that we're seeing in terms of referral support that might be important to highlight? Selena, I'm going to go ahead and read out your comment really quickly. You're a little confused. We talked about RDTs in the facilities, and so you're unsure as to why referrals would be needed, considering the use case of patients is already presenting at the facility. One of the big advantages of RDTs, you're right, is that they can be used at home, which would increase the advantages of the referral system. Hava, do you want to talk about that a little bit?
Sure. So we are looking at kind of a more comprehensive or wraparound solution that would take into account both the AGRDT test result, but then also potentially incorporate other patient information or be able to interface with kind of further clinical management of the patient based on the test result that they've received. So we are kind of exploring what kind of referral support would make sense as well. If it's not kind of fully comprehensive support, or just a kind of next steps on what type of facility the patient needs to see.
This is Selena. And are you talking about a new digital platform? Because I guess I'm also not sure why we would need a new one. I mean, it's great to have Damagi on the call, because it seems to me like some of this already exists, and we might be better off identifying what already exists and building off of that.
Yeah, we are definitely interested in understanding, especially in these expanded use cases, what already exists, because we would either want to potentially try to connect into those systems or just make sure that we're interfacing well. But kind of the baseline that this project will be outputting is a data capture tool for kind of standardizing what data is collected with antigen RDTs and potentially in the future other diagnostic tests as well. And so beyond that, for COVID antigen RDTs, we're wondering what types of functionalities would be helpful. So we are still very much kind of vetting these potential opportunities and hoping to not rebuild any wheels that are already existing. So that kind of feedback is really helpful, Selena. Thank you. And if you have if you know of you have existing tools in mind that you think really already fill these gaps or could fill these COVID-19 gaps, certainly let us know.
I'd be happy to share some of this perhaps offline as well, because we've done quite a bit of work on this also with Find. But in particular in India, there's some very specific laws about using their apps. And so I think we need to be careful to consider what the existing rules are as well.
Yeah, that's a great point. Thank you.
I'm happy to also mention another Dimagi project or product that was built in partnership with Find and others, probably on this call, called Cloudworks, which the idea of it is an e-reader to enable community health workers to follow set instructions and timers, and then to upload photos of RDTs, storing them on the Cloudworks backend, including and being able to kind of collect metadata and specialized reporting on the processes and whether or not the community health worker has gone through the instructions at all. Have they followed the instructions? Have they followed the timing that was required? Did they start a new RDT if that timing had expired, and all that information? And then this is all open source and created in partnership with and integrated with Medic Mobile and a few other digital tools. And so the idea is around full interoperability. Obviously, it's integrated as well with CommCare, and potentially the idea would to incorporate Circle in that process as well in terms of the referrals. So we can give more information on that offline, but it's currently, there was 3 pilots done with Find involving malaria RDTs. And there were, for 6 of the workflows, there were actually 3 algorithms to verify results. And then we are working on another project with Find around COVID and incorporating workflows for COVID RDTs and utilizing both the front end of Cloudworks, the RDT toolkit, as well as kind of the RDT specific workflows within CommCare and other digital solutions.
Yeah, great. Thank you for that. I believe we have integrated, or some of our vendors have integrated the RDT toolkit into the first phase of this project. So it's really exciting to kind of hear the potential expansion of that to the Circle system as well.
I wonder if we want to move on to the next use case.
Yeah, great. All right, thank you all for your feedback. So we'll move to the next case, which is around patient management. And again, some opportunities that we had identified, but certainly open to hearing more potential functionalities of an application that could support patient management at the patient level. We were considering centralized returning of results, as we were seeing a lot of kind of informal systems for the returning of results through SMS, phone, WhatsApp, or in person, and potentially 2-way communication with a provider. and that at the provider level as well, or a patient dashboard to kind of manage the number of tests that are being run on various patients. And at the district level, an opportunity for mass communication of accurate COVID-19 testing information, where to get tested, why to get tested, and some information beyond that. So if anyone has any thoughts on how to kind of centralize patient management or make that more efficient, we would really like to hear your thoughts. Or if anyone has been working around within COVID diagnostics or specifically Antigen RDTs, and you have experience in kind of the returning of results, and if anything is really just working well right now, we would like to hear that as well. We heard from a lot of interviewees about the usage of WhatsApp. So if that's really working well where you're working, that's of interest as well.
Could I just ask a quick question? I'm just wondering why it would be a challenge to return results with antigen RDTs that take less than 30 minutes to run. Wouldn't the patient just remain at the facility or get their own result?
Sure, excuse me, they are often at the facility, but there's requirements to also provide kind of written feedback of that result as well, whether it's for their own information or it's required for returning to work or travel or things like that.
So Annabelle, I missed your comment, but I'm just going to go ahead and read that out loud as well. So this is from I think the previous question, but you agree with Selena's perspective and wonder how standardization of data is going to occur when the use of some of these RDTs will be used at home, for example, and what extra burden another tool will put on community health workers who are already feeding into a national surveillance systems. What information would you need that surveillance systems are not capturing, and what's that gap info that is not getting captured? That was a lot, but essentially, what is the standardization across the data that you're looking for, and then what additional burdens does that put on community health workers?
Sure. So I guess some of the standardization that we're looking for is around the patient information and the test result information that's being captured for RDTs, just because it can vary from types of facilities and certainly between countries, and we want to try to standardize that data capture to inform kind of country level and then also potentially global level policies using these more standardized data tools. And what burden that would put on the healthcare worker, especially community healthcare workers, we are certainly aware of that potential burden and I mean, our goal is certainly to alleviate it and to try to streamline some data entry into national surveillance systems. But how we would get there is kind of where we're exploring these expanded use cases and what's really feasible and what's not. So that's one of the big questions that we're trying to answer in this project. Maybe I'll give people a few more seconds to think about potential opportunities for patient management, or we can move to the next slide. All right. So a bit beyond patient management is also the further clinical management of patients who have received RDT test results. And at the patient level, a kind of future area could be around self-testing results reporting, a chatbot for COVID-19 questions and answers that could be asynchronous. At the provider level, a mobile platform for providers to connect with each other, a contact tracing platform that could be linked to existing patient data, and the ability or support in running the antigen RDTs. At the district level, the potential for patient data to be linked to contact tracing again, sample collection coordination, and at the country level, results follow-up and procedure recorded for country level analysis. So if within clinical management, if anyone has thoughts or has experience in kind of what is done after the RDT is run, we would love to hear your feedback. And I'm also definitely interested in hearing from people who have dissenting opinions on anything on the slides. If you have any pushback, we would definitely take that. That would be helpful.
Are there any tools that you guys have seen that are already doing any of these activities well that we should know about?
I think especially in the area of contact tracing, if anyone has experience with digital tools, that's something that was coming up as a burden for a lot of providers. All right. Well, if people don't have thoughts now, we will be sending out a short survey. If you could if you have thoughts later and you want to provide any feedback, certainly open to that. So we'll move to the next slide, which is a use case around digital record keeping, reporting, and surveillance. So at the patient level, we're investigating storing all data associated with patients' COVID-19 management. So from antigen test results to PCR test results to any care that they have received for COVID-19, if that could all be in one centralized location for the patient to access. At the provider level, a mobile data capture tool at the point of care and access to stored patient records. At the district level, some kind of automatic reporting of point of care data and linking patient data across facilities. And at the country level, aggregation of point of care data to higher level dashboards and the ability to connect distinct information systems were all potential opportunities. So I think maybe this is an area of kind of broader discussion as any of you are working with different digital tools. If you're finding I guess I would love to hear kind of the key challenges that you're finding in using digital tools for COVID-19 management in general, or any thoughts on existing tools within these opportunities. Especially, I know somebody in the comments was previously mentioning surveillance systems and how to input data into those. So if there are already digital tools that are being used to support that effort, we would certainly like to know about them. Or maybe in a different, slightly different train of thought, who you would think kind of the users that have the most burden for this digital reporting, surveillance, and data capture, or record keeping, excuse me, which users within the like across the spectrum really have the greatest burden?
This is Selena. I just have a question. Did you do interviews in each of the countries? And is this what was identified by health workers as the main gaps? Because what strikes me is that we're designing a system for COVID management that could fit into existing systems. And I wonder if we're going to make things more complicated for the healthcare workers rather than more straightforward.
Right. And so actually these were kind of higher level stakeholders as were mapped out on one of the slides. We are hoping to engage with more healthcare workers in the next steps, but we were trying to kind of understand higher level gaps where a digital tool could be helpful. So we are still trying to receive more feedback around, more direct feedback from healthcare workers. And these were more opportunities that were developed by our team based on the thoughts that we were hearing in the interviews.
I'm just wondering if it makes sense, to the extent that there's gaps in like patient COVID management, whether using an existing platform makes more sense because the healthcare worker would already know how to use it and be comfortable with it, rather than kind of adding additional burden of another platform that they need to learn.
I'm sorry. Yeah, we're certainly keeping that in mind, which is why we're trying to understand what platforms are in existence and could be leveraged as well.
Mm-hmm.
You guys have thoughts on platforms that might be valuable to think through as we're looking at digital record keeping, reporting, surveillance, or any of these use cases? I know we've identified a few of Demonge's, but just kind of wondering what else there is out there that you want us to keep in mind.
I'm wondering about Medic Mobile, but I'm not sure. I assume that there's multiple platforms. I don't know which ones they are, though.
Okay, great. Thank you. All right, we'll jump to the next use case then. So we also investigated capacity strengthening for various levels of healthcare workers at the provider level. We looked into training, and this is kind of still an area that we are exploring because we heard from a lot of stakeholders that kind of in-person training was heavily preferred. but we did think that potentially a digital support of in-person training could be developed, or automated updates and reminders for new guidance or training material that's pushed out at the district or country level. At the district level, potentially facilitation of in-person training and workshops coordinated through a digital solution, and at the country level, a centralized online portal for all guidance and training, which we saw exists in some contexts like in India, but not everywhere. So if people have thoughts on kind of the existing capacity strengthening methods or areas where for other health issues, digital training has been successful, we would love to hear about that.
Hi all, I'm Lisa from Dimaji. I've just joined. My previous company was Everyone Mobile, and we successfully did digital training on mobile platforms. So there are a lot of products out there that do digital training, and as long as you keep it really, really simple, and you have all sorts of checklists and questions, then it can be really, really useful in getting across the information. And again, you can include automated updates and reminders if there's new training material, but getting all your providers to register and complete the material, that is one of the things, although you can monitor who has completed and who hasn't in those kind of digital training systems. So there are a lot of existing systems out there.
Great, thank you. And I guess that's a great point about getting people to actually register, especially thinking in the COVID context of people that are really overburdened and are kind of stretched to the limit in how they're working. We're trying to understand what are potential training avenues which could relieve some of that burden instead of add to it. Is that something that you've explored in the past as well?
I haven't. I'm more on the technical side. What I do know is what Dimaji's tried to do in their Cloudworks product is actually put step-by-step instructions for doing the test right there. So what you're doing is you're showing the step-by-step training at the point of when they're actually doing it. And sometimes that's more useful than some involved video that shows it to them a week before they're actually doing it. So I think that's one of the most useful ways of giving people direct support at the time they need it.
Yeah, that's great. Thank you so much. Does anyone else have experience in either training of healthcare workers or also kind of how to provide timely updates of changing guidance, especially in the COVID context? All right, if not, we'll move to our last use case, which is around supply chain support. At the provider level, we were considering standardized inventory forms that could be sent directly to the district level, or semi-automated inventory reporting. At the district level, this would feed into inventory management systems and support in preventing stockouts and in predicting ordering. And at the country level, this would really enable demand planning based on aggregate RDT utilization and results data. So if anyone has experience or knowledge of existing supply chain management digital systems, then we would love to hear about those as well. Or any real big issues in kind of coordinating supply across all of these different facilities, especially in such a time when kind of volumes are fluctuating. If not, I will certainly thank you all for your thoughts during this kind of synchronous presentation. We would certainly welcome your feedback at any point through the Google form, or I can put my email in the chat, and you are welcome to message me with any thoughts at any point. Thanks so much for engaging. So we'll just kind of start to wrap up. So this is just kind of a broader overview of what our team had thought for opportunities across our use cases at different levels and how we had worked to prioritize them. So our thinking right now is really to focus on digital record keeping, reporting, and surveillance, and potential use cases across the provider level, because that's where we're really seeing that the greatest unmet need and greatest burden is falling onto providers at this point in the Antigen RDT rollout, and that there's great potential for a digital solution to alleviate burdens within this column of digital record keeping, reporting, and surveillance. And so that's still a kind of hypothesis that we're testing out, and we would really appreciate your feedback on in the Google form if you have any thoughts. And let's see, and then just kind of those were our major takeaways from the stakeholder market needs assessment, was to focus on providers and that digital record keeping, reporting, and surveillance. And so based on feedback from various important stakeholders, we are hoping to kind of narrow down into specific use cases and functionalities to be developed in partnership with a developer for a new digital solution. And I guess I did just want to go through, highlight some limitations that we had during this interview, was that we had a smaller sample size of only 24 stakeholders, and they were really based on existing relationships that our team had, our partners had. And we were interviewing in a time of a highly evolving COVID context, which was affecting case rates, government policy and guidelines, testing availability, access, and much more. At this point, we did not speak directly with healthcare providers or patients. That is slated for the next parts of this project to really vet some of the hypotheses that we're developing, and that this generalizability may be limited, especially based on geographical context. And that finally, our next steps for this work are really disseminating it with key stakeholders such as yourself to receive input and validation for the proposed prioritization of these use cases. And we are hoping to discuss these opportunities and address the key challenges with global health vendors and develop a solution using human-centered design principles with our Path Living Labs team. And finally, implement and test this digital solution in 1 to 2 geographies. So I just wanted to thank you all so much for taking the time to engage with us and kind of take a look into some of the research that we have been doing around antigen RDT testing and more broadly COVID diagnostics. And we welcome your feedback at any point. And so I think Runda will be sending out the Google form, and I'll put my email in the chat, and I'm happy to engage with any of you at any point. Thank you so much.
Thanks all. The Google form is already in the chat, and you'll get it via email in the next few days with a recording of this webinar, as well as a full slide deck that if you want to kind of jump in and learn a little bit more about each of the countries, you can. So I'm just going to echo Abba. Thank you so much. It's great hearing from all of you. Have a great day.
Thanks, everyone. Bye.
Thank you so much.
Thank you.